Hey guys, Woodruff here. So we're breaking down EKG rhythms and we're doing a step-by-step process and then we're going to bring it all together. So the next step is, can you see regular P waves? So another thing you can ask yourself to help to discern which rhythm you're looking at is what is going on with the P waves. So what you would want to see, you should see if you have normal P waves, is like what's going on at the top here where there's an upright P and there's a P before every QRS. Or pointy thing. But what you want to look for to help tell you what this rhythm might be is if there is non-discernible P waves or if there's P waves that are not there. So if you have no P waves in a skinny QRS, when I say no P waves, I mean like literally you can't see any, and it's usually a super fast rhythm. You're usually looking at supraventricular tachycardia. If there's no P waves and you have a fat QRS, you may have a ventricular rhythm, and we'll look at these. There's some examples of this in the next slide. But then like at this bottom one, if you have abnormal P waves where there's, and you might be like, well, how do I know abnormal or absent? Well, there's something going on here with supraventricular tachycardia. All you see is the QRS because in the T wave, like there's no space for anything else. So what you're going to really want to focus on here is this abnormality, abnormal P waves, and like, or the fibrillatory P waves, or those flutter waves, or those sawtooth waves. Those are going to be irregular P waves. Usually it's AFib or aflutter. So effectively, that's our process. Let's actually do this step with all of these rhythms. So let's look at, do we have a normal P wave or not? So for this one, there should be a P wave somewhere in here, and all I see is just a bunch of squigglies. So if I see a bunch of squigglies and it's abnormal, look, it's also an irregular rhythm. There's different space here than there is here. There's different varied space. So I have an irregular rhythm that has these fibrillatory waves. So I most likely have AFib there. Then for this one, let's look at this. P wave, QRS. P wave, then QRS. This is supposed to be arrow. QRS. So P wave, QRS. So I'm not saying that this is a perfectly normal rhythm, but there's a P wave before the QRS. And so that's really what we're looking for here. So this one has regular P waves up here. So this one is regular P waves. This one is, I'll put IR for irregular. So let's look at this one. Yeah, I don't see any P waves. So this is the one where, when I said on this last slide, where if there's no P waves in a fat QRS, you have a ventricular rhythm. So this is going to be my VFib. And I cannot see any P waves. All I see is a big fat QRS. So that's going to be a ventricular rhythm. This also, with VTAC, if you remember, there's just a big fat, what do you call it? A big fat QRS complex. So this one happens to be VFib, but you also you're not able to see P waves in VTAC either usually. So here's another one. So this is what I was talking about if you have a skinny QRS, but I can't see any Ps. And people always ask, how do you know this is a T wave? It's just because of how it comes off of the QRS. And with these rhythms is that the T wave never really disappears unless you have a really bad rhythm, like a ventricular rhythm. But the P wave can disappear if my heart's moving super fast. So I have a whole bunch of QRSs, they're skinny, it's fast, but I can't see the P wave. So here, this is most likely SVT. And remember this section, if you're sitting there like, how is she doing this so quick? Remember, we're going to go through and do some practice together. More so here, I just want you to look at the P waves. Now let's look at this bottom one. So again, I have these strange P waves. It's kind of that fibrillatory look. I've got an irregular rhythm. Most likely have AFib, but these are irregular P waves. And so these two are also irregular and irregular. And when I say irregular, I mean is that I can't see them, they're hidden, or they're fibrillatory. It doesn't matter, it does help you to know that for each of those. That's why I put this on this last slide, that like it depends on what's going on with your QRS, is the rhythm fast, stuff like that. But just know that the thing I want to hit across here is that you want to look at what's going on with your P wave, because a lot of times it can tell you what rhythm that you might be in. The next and I believe last portion of the interpreting EKG is going to be, is the QRS skinny or fat? Hope to see you for that one. I can speak.